Hello, Dr. Manjunath.
Hello.
How are you today?
Yeah, fine. Very good.
Doctor, today we will have a small chat on endurance activities.
Yes.
Can you elaborate on these endurance exercises?
Endurance exercise consists of HIIT, which is high intensity interval training, and long distance marathon running or long distance ocean swimming or triathlon. These are all the tests which are done to improve your cardiac endurance and make you fit more. But what normally we advise is if you want to indulge in this HIIT, it is 2 or 3 times a week. Other days you can involve in the moderate intensity exercise.
So, what are the precautions or investigations, evaluations we need to undergo before we start these activities?
Especially HIIT and endurance exercises, if you want to involve, you have to do a health checkup before. Because as you know, there are a lot of diseases without symptoms. So these are all demanding exercise. Therefore,
a general health checkup includes physical examination by the doctor, a simple ECG, chest X-ray, and the blood investigation which are routine, followed by sometime imaging like ultrasound. If we find any problem with these investigations, we will ask for a complete cardiac checkup.
Cardiac evaluation includes an ECG, an echocardiogram, sometimes treadmill, and sometimes we advise a CT coronary angiogram also. So by doing these tests, we can identify who are the people who are fit enough to do these tests. For example, there are many diseases which have no symptoms, as I told you. Sometimes you can have a inborn ECG abnormalities where you are prone for arrhythmias, what we call as a tachycardia, heart rate going up. You can have a valvular heart disease where your valve is narrowed in the heart. You can have a abnormal muscles of the heart muscles called cardiomyopathies. You can have a high blood pressure without your symptoms. So all these things has to be evaluated before you indulge in endurance test.
Okay, doctor. Are there any other informations regarding the diet and nutrition and hydration?
Yes, most of the people who indulge in this demanding exercise should have a very high quality nutrition. That is one. Second one is the hydration. Lot of importance is given for hydration because hydration, if you are dehydrated, it leads to a lot of events. Probably you might have seen many of the celebrities or some VIP people or even common people having a mortality while doing heavy exercise in the gym or going for marathon running. So all these things are happening because of the dehydration. So when dehydration occurs, if it is not replenished immediately, so what happens is our blood will become thick. The viscosity increases. Viscosity increases causes the clot formation. And also it causes what is called as endothelial dysfunction in our tongue. That is nothing but to increase the inflammation. Inflammation will attract the platelets. Platelets will clot inside the arteries, whether it is to the heart or to the brain, causing the cardiac events. So therefore, we have to replenish water, and hydration can be in the form of water, ORS, then juices like pomegranate, very good juice, as well as watermelon, and in fact berries also. At the same time, cold milk is also a very good hydrating, for hydration it's very good.
What about tender coconut, doctor?
It's also good.